Boxed up, ready to go. A few weeks ago, this factory's biggest clients were people making cakes. Now it's NHS trusts. Faced with a global shortage of personal protective equipment, the machines at this Midlands manufacturer are now pumping up face visors morning, noon and night. But while ministers say there is a supply shortage of PPE around the world, the boss here says there is capacity among UK firms.
As of now, we're making 100,000 a week.
100,000 a week? What could you go up to?
Oh, I reckon easily 500,000 a week.
How much do these cost?
For this mask here, about 50p each. So they're throwaway items that the nurses, the doctors could use, care home workers could use, and they throw it away. At the end of the day, it can be recycled to make new plastic.
Some of the urgent equipment needed is pretty complicated kit, like ventilators. You can't just start cranking them out overnight. But much of the equipment there have been shortages of. It's pretty simple. And with the right manufacturing, you can mass produce it quickly, cheaply. And here in the UK, the frustration in many quarters has been that efforts like this could have been up and running from the outset.
At the virtual House of Commons Health Select Committee hearing today, the Health Secretary Matt Hancock was asked about the government's PPE preparedness again.
We have a global shortage of PPE.
And again.
I would love to be able to wave a magic wand and have PPE fall from the sky in large quantities.
In shortest supply, hospital gowns. Factories across the UK have switched to stitching them together, but under new guidelines for their use, Mr Hancock said it will be a struggle to ensure hospitals don't run out this weekend.
We are tight on gowns. That is the pressure point at the moment. We have another 55,000 gowns arriving today, and we're working on the acquisition internationally of more gowns, but it is a challenge.
The Health Secretary said coronavirus testing would now be extended to include the police, fire service and prison staff, although the number being tested daily is still less than half his promised 100,000 by the end of the month. And on Thursday he said there had been 847 new COVID deaths recorded in UK hospitals. The total now stands at just over 14,500, but the committee was told that number could rise significantly.
The recent estimates, even from the chief scientific officer, is that after this wave, which could kill, we could see 40,000 deaths by the time it's over.
The need for a vaccine is urgent. This afternoon, the Business Secretary said an extra £14 million would go towards 21 vaccine projects, but he didn't sugarcoat the chances of success.
Producing a vaccine is a colossal undertaking, a complex process which will take many months. There are no guarantees, but the government is backing our scientists, betting big to maximise the chance of success.
The government says more is being done every day to battle coronavirus. Some in industry say more should have been done weeks ago.
Is there a puppet master above us all? It's all frustrating.
No.
Should there be, though?
Yes, I believe there should. I believe that we need to be led in a firmer way by government.
A government fighting to keep ahead of a crisis. A government which tonight advised hospitals to reuse single-use gowns where possible.
Paul McNamara. Well, a little earlier I spoke to Jeremy Hunt, chair of the Health Select Committee and a former Health Secretary himself, and I asked him what he made of evidence before the committee that we could expect as many as 40,000 deaths in the UK at the end of this particular season of COVID-19.
The crucial thing now is to look forward, because there'll be lots of time to discuss all those things when this is behind us, and to say, are we following global best practice? So somewhere like Germany, that has a population a quarter bigger than us, has deaths around a third of ours. Somewhere like Korea, that actually had the virus worse than us, but has never had more than 9 deaths on any single day. They are the international best practice. And I think what was most encouraging from today's hearing was it was the first time I think we really heard the Health Secretary talk about mass community testing as being a very important part of the government strategy.
I think we do owe it to the deceased and the loved ones of the deceased to ask some fundamental questions about mistakes that may have been made. So here's the question. Had we been more prepared on testing, on PPE kit, on tracing, Could we have avoided some of the many lives lost now?
Well, I asked that question very directly to Matt Hancock when I said, should we have introduced the 100,000 tests a day target on March the 12th when we stopped community testing? We have now the chance to get out of this lockdown and adopt international best practice, but it isn't just testing. It's also about contact tracing. We've got to act fast, because if we want to lift the lockdown in 3 weeks' time, the World Health Organization says you must have this trace and tracking system in place before you lift any lockdown.
In fairness to the government, and in fairness indeed to Matt Hancock, the Secretary of State, you had that position for 6 years. I think the longest of anyone who's ever had that job. In that time, were you not responsible for running down our stocks of ventilators to whatever it was, 5,000 at the end of your period, and not getting the quota of ICU beds per 100,000 of the population to levels, of Italy or Spain or indeed Germany? That was on your watch.
I don't believe so, but we need to look at everything that I did, everything that health secretaries prior to me, governments prior to my government did, because this has been such a huge thing for our country. We need to get to the bottom of any mistakes that were made without fear or favour. I did believe that the NHS needed more capacity and more money when I was Health Secretary, and that was why I fought very hard for the £20 billion increase in the NHS budget. But it takes 7 years to train a doctor, it takes 3 years to train a nurse, so it's going to take time for those things to feed through.
The Health Secretary a couple of weeks ago said that there would be 100,000 tests a day by the end of April.
Well, his officials seem to believe it's possible. It's obviously going to be very challenging. You can carp if he only got to 90,000 tests, but that is such a dramatic change from where we were just a couple of weeks ago.
We had a piece in our programme just now that showed a company in Coventry that is producing 100,000 visors a week. They can easily ramp that up to 500,000 a week. They have not had any requests from the Department of Health. There's been no real contact from the government. This is the kind of communication that needs to take place now, isn't it?
What was very clear talking to Matt Hancock is the biggest concern is running out of gowns over this weekend coming up in the hospital estate part of the NHS. So they are working very hard on all these issues. But I think my biggest concern when it comes to protective equipment is actually the social care sector. It's what happens in care homes and indeed in the home care workers.
We have been talking about this for weeks now, the lack of PPE kit in care homes amongst community nurses and so on. Again, I don't know how to put this in any other way. Why hasn't this already been sorted out?
It's been a big frustration, and I don't speak for the government. Matt Hancock said that by this weekend, 1 billion pieces of PPE kit would have been delivered. But I'm sure we are going to learn from this what needs to happen with supply chains in future. President Macron apologised to the French people for the problems in getting PPE equipment out in France. So it's been an international phenomenon.
Well, do you think that Matt Hancock or indeed the government, someone from the government, should apologise to the doctors and nurses who've not been getting the kit that they need in order to do their work?
Well, I think it's for them to make a call as to what they say.
But if President Macron did it, why don't they do it? Eat humble pie on this one.
Well, Professor Costello, who's been very critical of the government's approach to testing over the last few weeks, he pointed out this morning this is not a time for the blame game.
Jeremy Hunt, thank you very much indeed.
Thank you.
Well, Professor Anthony Costello, who you just saw Jeremy Hunt talking about right now, joins us now from East Yorkshire. First of all, how do you get to 40,000 deaths in this first wave?
Well, at the moment, we're nearly at 15,000 on the daily death count. Most people think you should add on 50% for community deaths. That would take us up to about 22,000. Sir Patrick Vallance said today we're probably at the peak or the plateau, but that it's going to fall very slowly and it's going to take time. So if you do the quick sums, we're certainly going to head into the 30,000s. And I wasn't making this as a formal projection. I was just saying that this was the nature of the public health disaster that has befallen us. And I'm not aiming to criticize anyone to cause blame. I'm simply trying to do what we do as doctors when we would have, let's say, a mother dies or a child dies. You always do a no blame audit to really ask the questions, were there things that we done differently that would make a difference in future? And that's very relevant here, because we want to have in place a different kind of protection, assuming that the lockdown can really reduce this back to almost where we were, back in early February. We want to have a protective shield in place. And that's why I was asking these questions.
I mean, you talk about a second wave. Is that inevitable?
No, I don't think it is. It is if we just leave it. The problem is that on the second wave and the whole question of herd immunity, which I think was a bit of a distraction, is that at the moment, Neil Ferguson and Sir Patrick Vallance are saying, at the end of this whole surge, about 10 to 15% of the population will have been infected. Some recent models suggest it will be lower than that, only about 7%. Well, if we need to get to 60% to get herd immunity, that would mean an awful lot of casualties, because we would have to go through another, 5 or 6 or even more cycles. What we want is, of course, is a safe vaccine to give us safe herd immunity. But our questions today, and actually I came away rather reassured, because up to now they haven't really discussed the exit strategy. If we were too slow to test, which I think we were, are we going to be able to ramp up testing sufficiently to get that in place when we lift the lockdown? If we were too quick to stop contact tracing, which I think we were in many of the quieter parts of the country, are we going to have that in place logistically with our GPs, our public health teams? And if we were too slow to lift the lockdown, do we need to have a longer lockdown to make sure that we suppress this down? And in fact, Matt Hancock and his officials are clearly looking at all of these questions. They are ramping up testing. I think we can get there if we've got another month to go to have enough to supervise this in the community. They have a team working on contact tracing, digital apps, and of course they've set up a vaccines task force. So I think they're learning those lessons.
And what did you make of this sort of, I wish I could wave a magic wand kind of response to the shortage of PPE? I mean, is it the case that nobody could have seen this shortage coming?
Well, back in the exercise Cygnus, this was the secret and unpublished pandemic exercise they did in 2016. I think the decision was made in that, from what I've read, that they wouldn't go for stockpiles of PPE, they would go for supply chains. And obviously, in a global pandemic, supply chains quickly can't deliver because there's such a global demand. And I think that's one of the lessons we're going to have to learn. To be fair to the government again, sorry.
I'm sorry to cut you off, but we've got to leave it there for now. Thank you very much indeed for joining us.
Thanks, Chris. Now, the government has today extended its multi-billion-pound support scheme to pay an 80% wage subsidy to firms forced to furlough their staff during the crisis. It'll now run until the end of June. But there are gaps. Hundreds of thousands of workers who are about to start a new job weren't eligible. After pressure from campaign groups, the government this week extended that cut-off date as well. But experts say that huge numbers of workers are still excluded. Well, our social affairs editor, Jackie Long, is here. Jackie.
Well, there was huge relief for millions of workers when the government first announced this scheme. I think there'll be huge relief for millions of workers and businesses that they're extending it. However, within days of launching this scheme, it became clear that there was a significant gap. People who were about to start a new job after the end date of 28th of February wouldn't be eligible for the furlough scheme, even if they started work on the 1st of March. Now, the government have always argued there has to be a cut-off date to avoid fraud, but it quickly became apparent that so many of the people who weren't eligible for this scheme were people who had always worked, who had always paid their taxes, who had always, in their own words, done the right thing. So the government did move. It extended the deadline till the 19th of March, arguing that an additional 200,000 people would now be eligible for the furlough scheme. Experts say that number simply cannot be correct and that tens and tens of thousands of workers will still be excluded. And we've been speaking to some of them. Making the best of life in lockdown. But Lee Sapphire says not knowing how he's going to be able to provide for his family means it's living in a pressure cooker. Lee had just started work for a tech sales company when the lockdown hit, and like millions of workers, he was told to stay home. But unlike many of those workers, he's not eligible to be furloughed because he missed the deadline by a matter of days. He's worked and paid taxes all his life. His wife, a teaching assistant, is a key worker. The sense of betrayal, he says, is huge.
It hit me like a ton of bricks. What am I going to do? The first thing I pictured in my mind was my wife and my children. And I thought, you know, my duty as a parent, as a man, is to look after my family. And they took that away from me. And it absolutely devastated, and it's wrong. And they have to do something about it to put it right. They've caused this, they need to rectify it and help me and thousands of other people like me.
I know that people are worried about losing their jobs, about not being able to pay the rent or mortgage, about not having enough set by for food and bills.
This was the Chancellor announcing his multi-billion-pound job retention scheme just a month ago.
To all those at home right now, anxious about the days ahead, I say this: you will not face this alone.
But thousands of workers took to social media to say they feel exactly that, left to face this crisis alone. They didn't qualify for the furlough scheme because on the initial cut-off day of February 28th, they weren't on a PAYE scheme, usually as they were due to start a new job. Nathaniel Farrell was one of them. With his wife Catherine, a newly qualified nurse, he's due to move into their first home of their own in months. There's a new baby on the way too. But he'd just started a new job as a hotel chef on March the 2nd, missing the original deadline by 2 days.
Wow. Just came home to an empty house. Yeah, and then it just hit me that all of that, everything that we're trying to plan and do potentially can't happen now because my wage is just not there anymore. There's zero coming in now, so yeah.
Sitting in the empty room thinking about all of that, what did you make of it? How were you?
Oh, well, I'm quite a positive person. Obviously, I got very emotional. Yeah, sorry.
Nathaniel joined thousands of workers calling on the government to adjust the scheme. Then on Wednesday, a change to the guidance on the government website. Employees could be included as long as so-called real-time information confirming they were on the payroll was submitted to HMRC by the new date of the 19th of March. That issue of real-time information is critical.
To count to get furlough, they had to have been on a feed that went to our HMRC before the 19th of March. All those paid monthly, which is 80% of people, your company will not have sent its RTI feed to the revenue by the 19th of March. I think certainly there will still be over 100,000 people who will not be helped by this, easily. I think the initial launch of the furlough scheme and the self-employment income support scheme was very positive, and the state should be applauded by putting so much support in place so quickly. But the longer this goes on, the more gaps we see in the system, and those gaps are much bigger than was initially established.
And from some of those who've fallen through the gaps, this message.
We've done nothing wrong and we don't deserve it. We should be furloughed like everybody else. Let's do the right and proper thing and help us.